Home. Home is where the heart is. An interesting saying considering how alike they are. Not seeing it yet? Well, allow me to enlighten you. The heart has very specific pathways, much like the electrical wiring inside the walls of your home. When you plug something into the wall, the impulse goes through the wiring and into the different cells of the heart, giving them a jolt, which causes the heart to contract and pump blood to the body. As long as the system remains flawless, the beat goes on and life is enjoyable. Occasionally, however, a glitch in this mechanism occurs, an interruption in the heart's electrical system, leading to what is known as an arrhythmia. Arrhythmias often begin in the following areas: the sinus node, the AV junction, the atrial cells, and the ventricular cells. And while the specific cause of arrhythmias can remain unknown, the treatment depends on the type of arrhythmia that has developed. Today we will delve into the 5 main categories of heart arrhythmias: sinus rhythms, premature beats, narrow complexes, ventricular, and AV junctional blocks. So now let's visit each one and break things down a little further. Problems in the sinus node are due to the sinus node itself firing too slow or too fast. When the SA node fires at a slow rate, it is called sinus bradycardia. When the SA node fires at a fast rate, it is known as sinus tachycardia. Atrial premature beats refers to irregular electrical activity in the cells of the heart's upper chambers, the atria. This disruption can cause a condition known as premature atrial contractions, or PACs, where extra heartbeats occur in the atria before the normal heartbeat. In other cases, the premature contractions can originate in the ventricles, creating what is known as premature ventricular contractions, or PVCs. Narrow complex tachycardias include atrial flutter, atrial fibrillation, and paroxysmal supraventricular tachycardia. In these cases, the ventricular rate exceeds 100 beats per minute, and the QRS complex width is less than 0.12 seconds. In the case of atrial flutter, atrial cells fire continuously due to a looping reentrant circuit. This type of pathway occurs when an impulse loops and results in a self-perpetuating impulse formation. The electrocardiogram will appear in a sawtooth pattern as seen here. In the case of atrial fibrillation, the cells continuously fire due to multiple micro-reentrant wavelets, resulting in an irregular and often very rapid heart rhythm. Paroxysmal supraventricular tachycardia, or PSVT, also occurs due to a looping reentrant circuit. This causes a regular but rapid heartbeat that starts and stops abruptly. Ventricular arrhythmias include ventricular tachycardia and ventricular fibrillation, and while both are types of life-threatening arrhythmias, VTAC differs from VFib in that the heart beats quickly and in a more organized pattern rather than in an irregular rhythm as seen here. However, both will have an absence of recognizable P waves and a wide QRS complex. Atrioventricular blocks, known as AV blocks, are a partial or complete interruption of impulse transmission from the atria to the ventricles. There are varying degrees of AV junctional block, some of which are so mild they go undetected, and some so severe they may be life-threatening. The categories include first degree, second degree type 1, second degree type 2, and third degree. And while they are all distinctly different on an ECG, they are all a rhythm disorder that causes the heart to beat slower than it should. First-degree AV block is defined by an elongated PR interval of more than 0.20 seconds, as seen here. Second-degree type 1 AV block is characterized by a progressively prolonged PR interval, eventually resulting in a non-conducting P wave and an irregular R to R interval. Second-degree type 2 AV block distinctly differs from type 1 in that the PR interval is no longer prolonged. However, the P waves are increasingly blocked, as seen with the absence of the QRS complex. Third-degree AV block indicates a complete loss of communication between the atria and the ventricles. The P waves are completely blocked, forcing the QRS complexes to originate below the AV junction. Without proper conduction, the SA node cannot control the heart rate, and the heart is forced to function from the intrinsic pacemaker of the ventricles at around 20 to 45 beats per minute. That wraps up our segment on arrhythmias. And yes, that was a lot at once. But feel free to repeat this section, and to help, here's an arrhythmia chart to help your arrhythmias stay organized.